Hey everyone, what's up? It is Dr. Charlie PT. And in this video, I want to share with you something that I've been working on behind the scenes that I would love for you to be a part of. Specifically, if you're struggling to figure out why you hurt and you're looking for answers about what could be causing your pain, I would love to assist you with the diagnostic side of this whole healing process. So the topic of today's video is really at the core, sort of about the evolution of diagnostics within medicine for back, butt, and sciatica problems specifically, because that's all I do. And I want to share with you a bit about my background, how I arrived at where I am today, and how I feel the current diagnostic model is broken, because it is. And I want to offer a clearer, more common sense approach for you moving forward. I also want to offer you a way to connect with me more personally. So every day I have people that reach out to me from all over the world, mostly from YouTube, who have questions about what's going on and want my thoughts and opinions. And I'm just one person. So this is a way that I can connect with people more intimately and help more folks out. At least that's the hope. So I want to begin here in a moment by introducing to you something that I've created and something that I'm calling the DIY Diagnostic Network. So stick around if you're interested in hearing my story, how I got here, and sort of a new way that I may be able to help you out. All right, so let's chat about the DIY Diagnostic Network, what it is, how I got here, why I created it, all of that fun stuff. So the DIY Diagnostic Network is, again, a free group, all right? It is actually a private Facebook group. You can just, preview it here. So this way, if you're interested, you kind of know what to expect and what you're looking for. And, it is a group where I'm going to help people get clear and sort of figure out what's going on with them and why they're experiencing the pain they're experiencing. So the focus here is just diagnostics, really. And within this group, you'll have myself, right, who will sort of cover various topics around how you can determine the most likely source of your pain. So we'll talk about movement versus medical diagnosis. We'll talk about self-assessment. We will also share some specific video trainings that are just exclusive to the group and for folks in the group. And I want you to actually be able to review real recorded patient exams. And this is useful because, I can talk and I can share all this theoretical, if you feel this, then that type scenario. But at the end of the day, it's useful to hear from people like you that you can potentially relate to and who might help you better identify the source of your symptoms and figure out, again, what's happening. Finally, within the group, you'll get access to myself on Messenger, obviously, as I'm available. Again, I'm only one person, but I want to be able to connect with you more personally to help you get clarity on what could be causing your pain and answer any of the questions you have about this very sort of mysterious area, back, butt, and/or sciatica problems. And so look, if you want my help or have any questions about your diagnosis or lack thereof, because it's generally an all or none, like you go to a bunch of people and they're like, we can't figure it out, your images look normal. Or you go to different people and it seems like every person you go to gives you a different diagnosis. Then I invite you to join my free private Facebook group, again, the DIY Diagnostic Network. And you can do that. There should be some card above. You can check that out. And I'll obviously put it in the description below, maybe pin it in the comments too. All right. So again, the hope is that you will bypass the traditional diagnostic model of, seeing a specialist, getting x-rays, having to wait a week, going to an MRI, having to wait a couple more weeks, reviewing the results. What do we do, right? Getting injections, all of this stuff. So you can save a ton of time, energy, and money during this phase of the process. Because the truth is that so many people get stuck in this figuring it out phase. There's a ton of time, energy, and money that is just depleted here when it doesn't have to be that way. So think about it. You go to someone, they tell you something's wrong, you start treating it, then you're like, okay, it's not really working. You go somewhere else, right? You start to move to solution, to treatment. And then what happens is, okay, now you get a new diagnosis and you're back here, and then you get x-rays, MRIs, right? And by the time all this stuff is done, you might spend, weeks at the very minimum, but probably months. Some people even spend years or gosh, even decades going through this whole diagnostic just conundrum and old outdated model, when really the time, energy, and money needs to be focused on the treatment solutions, like living in action, doing and getting live feedback and then iterating as you go. So, why else did I create this network? And what's the catch, right? Like, why am I offering to help you figure it out inside the group for free? Good questions, and give me a moment to explain. So about a year ago, I created this guide, and this was really the sort of catalyst, if you will, for creating this DIY Diagnostic Network. And this is the guide. If you haven't checked it out, you can definitely check it out. It's linked under all of my videos. Better than an MRI DIY diagnostic guide, because I truly believe that. I truly believe that you don't need to spend your time, energy, and money going to specialists, getting an x-ray, getting an MRI for most cases or problems. We'll talk about when these things are useful here in a little bit, but most of the time they're just a big waste and energy, money zap. All right. And look, I created initially as a way to just document my thought process, everything I had learned about diagnostics up to this point. I've traveled all over the world learning about different treatments and ways to figure out what's going on with people, and working next to radiologists and spine surgeons and hip surgeons and all these different folks, a lot of great experience. And I thought, man, I've got to write this down. I've just got too much stuff in my brain. And then the teacher in me thought, right, and sort of the person in me thought, wow, this would be really selfish to keep this to myself. Perhaps it could help people like you. And so I put it out into the world to let people inside my mind to see sort of how I think, right? So that, again, if you're in pain, you could begin solving your own pain problem and just kind of, again, speed up that whole figuring it out phase and save a ton of time, energy, money. And this is the inside of it. Lots of sort of if this, then that algorithm. And I've laid it out in sort of a top to bottom flow chart fashion. So you can start here and just work your way through, again, giving you the best chance of solving this without needing all that stuff. And initially, when I released this, I set an alert to notify me of anyone who downloaded. So basically, I would get an email that says, so-and-so grabbed the guide, right? Because the truth is this, like, I knew it was valuable, but would anybody else want it? I mean, I knew I wanted it. And I knew other PTs and providers would want it. But I was like, does the world really care about this, or what's going on there? So what happened is just insane. So my inbox just started to blow up. And, you know, in a typical day, this is what it might look like. So Cam grabbed the guide, Aurora grabbed the guide, Rhonda grabbed the guide. All these people are grabbing the guide. And I was like, thank the Lord, this is digital. I don't have to send these things out, because I would just be like running back and forth between the post office or something like that. So they grabbed the guide. And so the feedback was very overwhelming and super clear. People in pain want answers and crave understanding of what's going on with their body and why they hurt. They're hungry for education about what they're dealing with, and they clearly aren't getting it elsewhere, or at least in the way that they're hoping for. So despite seeing many different specialists and having many different diagnostic tests, folks are still confused about why they hurt and what's going on with them. And, you know, on the other side, the treatment side, what the heck to do about it? And so much so that they turn to YouTube to find folks who think outside the box. And, you know, they end up finding people like me with stairs to nowhere. All right. And comments like, hey, doctors didn't take the time to listen. This is what people would send me. They didn't go through a thorough exam. They didn't even do any physical tests. They just told me, hey, take these pills or have these shots or you need surgery. Or here's the worst one. They made me feel like I was crazy. And this just pisses me off, right? We go to school, we learn all this stuff. Yes, it's in our brains, but this should be the easiest part of the process. This is diagnostic part of the process. Because as you'll learn here in a little bit, you don't need to be exact. You just need to get a ballpark, enough that will inform treatment. Most of the time, energy and money should be spent on figuring that stuff out, not visiting doctor to doctor, try to figure out what it is. All right. And surely you're not crazy. All pain is real. All right. So the experience is very, very real. And to just tell someone that seems nuts. But anyway, look, I thought it shouldn't be like this. And I probably at that point said to my wife, like, it's time to go to work. I've got a lot to do and there's a lot of people to serve. So I'm going to be working, and we'll catch up later. All right. So look, my first boss out of PT school, when I worked for a small outpatient PT clinic here in southeastern Pennsylvania, that's where I'm from, sort of ruffled my feathers, and I probably ruffled hers too, right? And again, full admission here, I was a bit of a bull in a china shop, always wanting to sort of think outside the box. I always had questions, not to offend her, but just like, hey, like, why are you doing that? Because I really truly wanted to know what I was doing and why I was doing it, as I think you should, right? But I was always sort of challenging the status quo. And she told me, Charlie, you can't change the world. I remember that day. And I was so ticked by that and driven that basically it became my mission. This is why I do what I do. And I have something, right? A vision, mission, principle thing that sits on my desk next to this bobblehead that one of my clients got me. And just to zoom in on that, right? Here's sort of what I live by. So the problem that, as I see it, is that healthcare is backwards, and people should get PT or conservative care first. Healthcare is full of fear tactics, misinformation, and rabbit holes. Factual, up-to-date information that everyone should know is out of reach. Why is it that you don't know what are in the journals, right, in a way that makes sense to you? Why is it that you don't know what I've learned about diagnostics? You can certainly move your own body and test things out on your own and answer some questions. By the way, you're the best person to do that because you're the one in pain. Why is it happening? And so my vision became to flip the pyramid globally as the go-to provider known for educating people with honest, empowering and up-to-date solutions to their pain problems. And the mission to simplify things for people in pain. No wonder people are confused when they read an MRI that says you have a grade 3 spondylolisthesis or lateral recess stenosis that's impinging upon this nerve or whatever. It's gibberish. It's hieroglyphics. It's not your fault. It's just that it makes us feel really smart. Maybe it's an ego thing, but it doesn't mean anything to you. And you are the people that we are trying to help. And you are the reason that I went to school. So to simplify things for people in pain by offering the latest, most effective treatment solutions and providing with reliable tools, DI Guide being one of them, and information that empowers them to take care of themselves and live a better life. If you actually own that information and you can apply it and sort of grasp it and begin to use it in your life, then you are much more empowered. So it goes back to like teach a man to fish and he can fish forever, but like fish for the man and he has no idea what he's doing. I have no clue what that is, but I can't remember the exact words. You know what I'm saying, right? And then the principle, there's many of them, but one of them that I sort of live by is learn, do, teach. Right now you're trying to learn maybe what's going on with you. What we need to do as quickly as possible and then teach others. And I want to teach others, people like you, what I've learned in a way that is easy for you to understand. And again, the DIY diagnostic guide that I created is just one way that I can do that for folks. And the group that I created is another way that I can help people bypass the traditional medical model. So people and providers from all over the world send me messages. Not only were people grabbing the guide, but they were also sending me personal messages to my email because I put it out there at some point and people found it. And I was getting these things daily about how the DIY guide has sort of educated them and provided clarity. So for example, this is just a few. Melanie, these are very recent. Thank you, Dr. Charlie. Appreciate your DIY guide and your videos. Oh my gosh, I feel like it saved me time, money, and pain. She doesn't feel like it saved her time, money, pain. It actually did. And she learned a lot and her condition improved quite a bit in a day already. And this other person, we decided I should consult a doctor. I was referred to a neurologist, but my back never hurt. I was scheduled to go get an MRI, $700 out of pocket. My gut was telling me it was a waste of money since I didn't have a back problem. Then I went to the YouTube rabbit hole and found your guide. This other person, Caitlin, thanks so much for putting this guide together. It's great. And I learned a ton. Then she shares her story and she said, any thoughts? So even though people were going through my detailed guide, they still had questions. And it was difficult to connect just via YouTube comments and things like that, and or going back and forth with email. So again, that is another reason I'm creating this network. James, thanks for your email. Thanks for sharing your guide. Really interesting stuff. I'll share my situation. Then he went on, I cut it off there to essentially write a book about what he's dealing with. James, if I didn't get back to you, I'm sorry, but you're in line. All right. And then Edward, he said, your video is probably more clarity on sciatica than pretty much anything else on the internet. It's about time someone came along who decided to deep dive into this terrible problem affecting so many people. He just wanted to start with the self-diagnostic guide, right, in my videos, and he can say already that he's able to manage his pain more now than he had in the past. He's able to sit for longer hours without as much pain. Cool stuff. And Quan said, thanks for your email, Charlie. Your diagnostic guide is amazing. I learned a lot from it. Shares his story. What is your opinion? Anyway, at the bottom there, this was kind of a little testimony to tell you your guide is awesome and really helping. It's from somebody else. I forwarded to my neighbor. Thank you for doing that. Gerardo, he's in trouble, but this is so not uncommon. This is very common. All right. He did all this stuff. All right. He tried x-ray, CT scan, imaging. Doctors told him there's nothing wrong with you. He's tried orthopedics, rehab, a second opinion, now a neurosurgeon, right? They're telling him to lose weight. And this guy legitimately wants to know what's going on. And nobody else can explain it. And I know why, but he doesn't. And that annoys me, right? And doctors honestly just don't have much time. I'm not making an excuse for them, but they didn't even do any physical tests or they didn't really do anything else. I can't tell you why that's happening, but he saw my guide and really loved it too. Now, even providers started reaching out to me. All right. So I created this for patients, but providers like, hey, we don't even learn this stuff. So, hey, I enjoyed your videos. I'm a doctor of Oriental medicine. Right. And they send me cases and they say, what do you think? This person is a PT student, caught you on the YouTube for the first time a few days ago. I enjoyed several of your videos thus far. I downloaded your DIY back pain flowchart because he has back pain and he's a PT student headed into his first clinical rotation. Good luck. And I thought the flowchart was put together well and offered a different intuitive way of looking at clinical reasoning. I used to teach clinical reasoning and unfortunately PT schools don't seem to teach it that well. So laying out this algorithm is very helpful for lots of folks, even when they're in school to do what I do. Hey, your free guide on better than MRI was super helpful in my outpatient orthopedic rotation. Much appreciated. No problem. So look, as a PT with a board specialty in orthopedics, I have extensive experience in both diagnostics and treatment of these back butt sciatic issues. It's my specialty. It's all I do. And my residency training and board specialty place my knowledge in the top 1% of PTs worldwide. And the truth is, I'm not sharing this to brag. I could care less. In fact, I will let my board specialty lapse. The letters don't mean anything. All that matters is that I can help folks like you. So again, I'm not sharing this to brag, and I didn't do it for me. I climbed the mountain for people in pain like you. I taught at USC and worked alongside hip and spine surgeons. I observed the way they interacted and learned the way they think. I studied their brains and their reasoning. And as a PT, I was trained by some of the best osteopaths, myofascial therapists, movement gurus, and pain psychologists in the world of rehab. The McKenzies, the McGills, right? Whoever it is, you name it, I pretty much studied it. And the goal was that I didn't want to leave any stone unturned. I learned what worked, I learned what didn't, what made sense, and what was missing. And most of the time, I really had no clue or idea what I was doing. I was like, hey, none of this really makes sense. And this is really frustrating because I feel like we'll never actually figure this out. But I'm just fascinated by learning this stuff. Like there's got to be an answer somewhere. Hence why I moved my family across the US and traveled all around the freaking place trying to figure this stuff out. But I trust that somehow in the future, the stars would align. And they have, and they will continue to. And that things would just make sense. So I lived by this quote. Steve Jobs, really cool quote. You can't connect the dots looking forward. You can only connect them looking backwards. So you have to trust that dots will somehow connect in your future. And fortunately, as a PT, it was clear early on, even though I felt like I knew very little. So it's hilarious because you go to PT school, you learn all this stuff, and you're like, woohoo, Dr. So-and-so. You walk across the stage and then you see your first patient and you're like, for the first, I would say 5 years, right? You were completely lost. And most people remain lost for their whole career. And that just seems crazy. But anyway, fortunately, it was clear to me. One thing was clear, that I had something surgeons and other specialists or providers did not. Time to listen to my patients, hear their stories, observe their movements and thought patterns, see their frustrations, listen to their fears, their worries, their concerns, and perhaps most importantly, teach them. You can't do anything else, at least educate them, right? So during my time as a resident, it wasn't unusual for an orthopedic physician or spine specialist that I was observing to see 70 patients per day, always running behind, spending a maximum of 10 minutes with each patient and making calls about whether or not this person should or should not get surgery. That just seems crazy to me. And this particular surgeon that I was observing was always loaded up on Mountain Dew. They'd have like 3 or 4 of those, is it 16 ounce or maybe it's even more than that, Mountain Dews. And he wore a suit and tie, like very well dressed, but the tie was either tucked into his shirt or flopped over his shoulder, sort of blowing in the wind as he was hustling back and forth. He was super tall, so his strides were like, I had to like run to keep up with him. And basically, I was just a fly on a wall observing all this. And all I saw was chaos and madness. You know, I observed mostly, sometimes help with injections, and would have extra time, there's that word again, to discuss cases with people in pain. In fact, I was often asked by the surgeon to perform preliminary evaluations for him, because he didn't really have as much time, and let him know what I thought prior to him busting in the room. And I'll never forget the day that this happened. A woman, whose name I can't recall, was scheduled to meet with a spine surgeon, a surgical consult, if you want to call it that, with whom I was, again, shadowing. And as usual, the surgeon and I reviewed her MRI. That's the way it works. You do the MRI, right? You review it, and then the physician sort of follows up with you. We were reviewing the MRI prior to entering the room. And it appeared as though she had a disc herniation, some stenosis or narrowing of the spine, compressing a nerve in her lower back on the left side. The surgeon, just like they all do, right? And then they open the door, right? Quickly knocked, proceeded in the room and followed up, hey, Mrs. whatever her name was, how's your left leg? Her eyeballs opened wide, the sides of her mouth drooped, and appearing confused, she responded, it's my right leg. And the image report showed problems on the left side, which didn't match her symptoms at all. There was no correlation there. And from that moment on, it was clear that things were backwards, completely backwards. We look at this image and we walk in completely biased by what the image says, right? So treating the image first and the patient second made no sense. Thankfully, as a PT, I don't do that. And plenty of evidence supports my experience as well, showing that structural problems found on images have little to no correlation with pain, and that most of the common diagnoses or supposed causes for why we hurt or feel pain are completely normal. So for example, this study proves that most abnormal MRI findings should be considered a part of the normal aging process and don't need fixing. They're often interpreted as problems and they get, we're happy to do surgery on them, but they probably aren't actually the source of pain. So treat the patient, not the scan. Most of these things don't need fixing. Right? This is kind of an old school study, but I think it was 2015, 2014. Basically shows that, lots of people who have no pain have things wrong with them. Look, disc degeneration, height loss, bulges, protrusions, tears, joint problems, that's facet, spondylolisthesis, any type of like slippage or whatever. And almost everybody, almost at any given age, right, has a high probability of having something wrong with them. So take that. Or how about the story of this 63-year-old woman suffering from back and sciatica pain? This is something I would do. And her curiosity got the best of her. Basically what happened, this was actually done right around me in Philadelphia. She had 10 MRIs at 10 different places, all within 3 weeks. I have no idea how she got all this approved or what the heck happened, but here's what she got. 10 different diagnoses. This is crazy. So here is the study if you're interested in looking up variability in diagnostic error rates of 10 MRI centers performing MRI exams to the low back in the same patient within a 3-week period. Can't actually believe this got published, but somehow it got through. So what does this tell you? You can't trust x-rays or MRIs and or specialists who read them. And one thing to understand is that the people who are reading them, writing the reports, don't actually know like anything about your story. They're the radiologist sitting back here. It's not the orthopedic surgeon writing up the report. They don't know anything about your clinical presentation. They're just saying, this is stuff that's wrong. And the orthopedist is pulling up saying, here's your problem, right? We can't trust these things. Determine what's really causing your pain in most cases. If all the stars align and everything makes sense, yes, but don't take these, have no physical exam done, have nothing else that makes sense, and then just be like, boom, here's your problem. That makes no sense. And look, this does not mean that diagnostics have no use. I can see the comments right now, like, hey, like you're saying these things suck, but they're actually really good. Yeah, they are really good. They're too good. So contrary to what you've been led to believe, the purpose of imaging is to rule out big, ugly, and scary things like tumors, fractures, infections, things like that. Not, and this is why people do it. I need to see what's going on. I want to rule in if this is the problem. I think I have piriformis syndrome, a disc problem, or whatever. That's not how they're used. Whether doctors agree to that because they make money off it, or because they're practicing defensive medicine because they're worried you're going to sue them or something if you miss it, whatever it is, I don't know. I'm just letting you know the politics on the back end. The goal is not to rule in natural occurrences like disc issues, arthritis, or muscle strains. You can go through a movement exam. I can ask you some questions and we can have a ballpark of that. All right. So these things are expected as a part of normal life. And luckily for you, these big, ugly, and scary things account for about 0.5% of folks, 0.5% of folks presenting with back, butt, and or leg pain. Meaning for every 100 people who present with back, butt, and or leg pain, sciatica type stuff, 0.5% of them, 100 people, take one of them, cut it in half, and that's the chance, right? Will have something sinister, big, ugly, scary, causing their pain. Which means that the vast majority, now this is my experience, but I would say vast majority, like probably 75% of people who get these images and diagnostics done don't need them at all. Yeah, that's just an estimate, but I would imagine that it's probably, not too far off. Vast majority of people do not require imaging and these diagnostics at all. So not to mention, people who undergo diagnostic imaging and tests do worse than people who do not. Not only do they not really help figure these things out, and they should be used to rule stuff out versus rule stuff in, which they're not really being used for that, they actually make people worse, and we have strong evidence to support. So this was a clinical commentary, yes, in a PT journal, but you can see there's an MD, on the list there. And I think it was 2011. So this stuff goes way back. We're in 2022 here, folks, when I'm shooting this video. Appropriate use of diagnostic imaging in low back pain. A reminder that unnecessary imaging may do as much harm as good. Synopsis or summary. The rate of low back MRI in the US is growing at an alarming rate, despite evidence that it does not improve patient outcomes. Overutilization of low back imaging in individuals with back pain correlates with and likely contributes to a 2 to 3-fold increase in surgical rates over the last 10 years. Surprise, you hurt, you go to a surgeon. What does a surgeon do? give surgery. I'm not talking bad on all surgeons. I'm just saying that's what they do. Kind of like, we want to figure it out and we want to fix it. And you ask for their opinion because that's what you think you should be doing. And they say, hey, we do surgery. And so if they find something on MRI, which they will, because everybody has something wrong with them, then guess what? You're much more likely to have that thing, which they found, operated on. So 2 to 3-fold increase in surgical rates over the last 10 years. And this is like old data. I imagine it's even higher now. Furthermore, a patient's knowledge of imaging abnormalities can actually decrease self-perception of health and may lead to fear avoidance and catastrophizing behaviors that may predispose people to chronicity. Basically, these things scare the heck out of people. And it's like, it's like watching a train wreck. It's like you don't want to watch, you don't want to remember it, but you can't help it. So you have this very black and white piece of evidence that this thing is wrong with you. And whether it contributes to your pain or not, you may never know, right? But it's hard to get that out of your brain. So every time you hurt, you go, oh my gosh, it's that disc. Oh my gosh, my vertebrae is slipping. Oh my gosh, the arthritis is getting worse. And none of that stuff's probably true, right? Just recognize that this stuff gets in your head. It's also a mental game. And dating back even to 2007, clinical guidelines, diagnosis and treatment of low back pain, a joint clinical practice guideline from the American College of Physicians and the American Pain Society. Multiple recommendations here. I'll go through some of the big ones. These are the recommendations for how we should be sort of treating back problems and utilizing imaging. Recommendation 1, clinicians should conduct a focused history and physical exam. Well, we don't. Most physicians do not. They do not go through a thorough physical exam. If you want a thorough physical exam, go through my DIY guide. It's there. You can learn how to do it on your own. And not only should there be a detailed physical exam, the history should include assessment for psychosocial risk factors, meaning we know that pain is an experience or output from the brain, and that you can feel pain in the presence or absence of physical structural damage. Now, this is where MRIs and X-rays, they try to zoom in on, but we know that doesn't always explain why people hurt. So is there stress? Is there anxiety? Are there other factors going on? Are there other pains in the body, right? Are there other things that make us think, hey, this person has an elevated state, meaning they're on high alert, and perhaps there's some other factors on the brain side of the equation that are contributing to this pain experience and making it worse. It's very real. It doesn't mean you're crazy. It doesn't mean you're making it up. But these things are worth screening for, because then the treatment may vary. The second recommendation, clinicians should not routinely obtain imaging or other diagnostic tests in patients with non-specific back pain. If you have back pain, butt pain, you're like, oh man, it just kind of hurts over here or whatever. Don't get an X-ray. Don't get an MRI. Recommendation 3, clinicians should perform diagnostic imaging in patients with back pain when severe or progressive neurological deficits, meaning weakness, you're losing your feeling, whatever, are present, or when serious underlying conditions are suspected on the basis of history and physical exam. Well, luckily we have different research that shows that if we ask these questions, then this person's at a high risk for potentially having some of those things. And it's clear via a movement exam, if the person actually goes through them, back to recommendation number 1, if the person has some type of progressive neurological problem, loss of feeling, loss of bowel or bladder, inability to kind of move the toes of the feet or use the muscles because the nerve is not healthy anymore. Recommendation 4, clinicians should evaluate patients with persistent back pain and signs and symptoms of radiculopathy, which is basically a pinched nerve, or spinal stenosis with MRI or CT scan only if they are potential candidates for surgery or getting shots. So you can answer that pretty quickly. If you come to me and I say, hey, look, tell me your story. And oh, by the way, do you want shots or do you want surgery? Nope, I don't want those. Okay, well, based off your exam, you don't have loss of strength or feeling or whatever. Why are we doing this MRI? We shouldn't be. And finally, clinicians, say that 5 times fast, should provide patients with evidence-based information regarding sort of what to expect, how to move, right? And how to treat themselves. But guess what? They don't. You have to come to YouTube for that. So the current diagnostic model is slow, outdated, and just completely dead. It's expensive. These images are expensive. Maybe not to you, but to the world, to the economy, expensive. They're inefficient. No, an X-ray can be done very quickly. But meeting with a physician, then waiting to set up the appointment, getting the x-ray, then waiting several days, right? Then meeting with the specialist to see what you should do about it. It's an inefficient timeline. You could have been better by now. And they're largely ineffective identifying the cause of pain. Everything and anything is going to show up. If you search, you shall find. But nothing on the x-ray or MRI says like, I'm the problem. I'm the problem that's causing the pain. It doesn't do that. It's misleading. 2 to 3-fold surgical increase. You have this thing wrong with you. If they find something, they will want to fix it, or the medical community will want to fix it. So we medicalize these findings when really they might not be an issue. So it can lead you down the rabbit hole of like, oh, I have a disc problem. That's in your brain now. You're going to do worse. And then you go and you chase it. I should do only these press ups, and I need a discectomy, and I need this. You might not need any of it. They're taken out of context. The person writing the reports, the radiologist, knows very little to nothing about your clinical presentation. So how can they comment on it? And they fail to provide folks with tangible information that leads to successful, natural first line of defense treatment. Cool, I got this stuff from MRI. What do I do about it? Well, pill, shot, surgery. Why would we do that? Exhaust the natural treatment solution and a pain relief process first. And look, these are only my opinions, so I'm not here to trigger or offend anybody. If I am, I'm sorry, but I just want to be candid with y'all. So look, instead of that old outdated diagnostic model, there's a new diagnostic model that's dynamic, interactive, and empowering. It involves you. You're the one with the pain. You're experiencing it. I feel fine. It involves you being educated about why you hurt, where you hurt. And this can be done easily by self-evaluation and logic that was once buried in medical journals, hoarded as specialized knowledge by doctors, right? Top secret and completely inaccessible unless you want to wait months to see a specialist. Not cool. So the new diagnostic model is fully transparent and completely exposed. This stuff gets me really ramped up. The diagnostic model, you should not spend months in this diagnostic process. You need to be living in action, following a systematic process to get better. And again, gathering feedback that is useful for helping you get closer to the truth. Whatever that is a treatment solution. Not stuck literally at square one, like, oh, I think it's this. Let me do this. Let me do more research. Oh, I think that, right? Not that stuff. This should be fully exposed. And again, this is how I expose it. It's all laid out here. And the group will expose it even further. So the path to figuring out what's going on with you is no secret. I learned it. You can learn it. And it's not a secret that I want to keep. Other people might want to keep it. I don't want to keep it. I want to help on the treatment side. Absolutely. People enroll in paid programs with me for that. I have a specialty program to help people navigate the treatment process, but that's extensive for lots of people. That could take months. It could take 8 to 12 weeks or more, with lots of things that come up and lots of nuances, right, within this process. But to spend that amount of time trying to kind of figure out the diagnostic side of things is really a delay. It doesn't need to seem so hard. There's no secret to it. I'm telling you that. It should actually be very quick, very quick. Does the person have, so let me go back. Does the person have something big, ugly, scary? Are there signs of cancer? Are there signs of, tumor, fracture? They have any trauma, this, that? You can rule these things out. Any signs of infection? Okay, cool, no. Now we can do some different movements. Okay, is it roughly coming from their back? We know it's not life-threatening. Do they have neurological damage that warrants an immediate surgical recommendation or referral? No. So no tumor, no fracture, no infection, no immediate neurological deficits that require immediate surgery. Great. They're going to natural treatment. Now, what is the cause? Well, wiggle the back. Nothing happens. Not the back. Wiggle the nerves. Nothing happens. Not the nerves. Wiggle the hip. It's a hip problem. Great. It's probably in or outside the joint. That's it. Move on. We can narrow this down. So based on feedback from thousands of people across the globe, the number one sticking point for folks in pain is, this is where they get caught in this holding pattern. I need to figure out what's going on. I need to figure out what's going on. I need to figure out what's going on. And if I could just figure out what's going on, then I'll know how to fix it. And again, it's not your fault, because this is what we're indoctrinated to. And if you're like so many people, right, that I chat with, who want to exhaust any and all natural treatment first before getting in invasive things like shots and surgeries, then the cool thing or truth about this whole getting out of pain process is that you don't need to know exactly what's going on. You just need to get a ballpark. And if you do want to heal naturally, you definitely going to see a specialist, things like that is probably not the right choice. So another cool thing, you can totally do this. I've laid it out in the DIY guide, and inside the group, I can walk you through it further. And using a combination of your story, location of where you hurt, right, movement exam, plus my experience, it's totally doable to dial in on the most likely cause of pain without diagnostic tests, painful injections, or endless visits to a specialist. If you need to see a specialist, great. I literally just had a lady who emailed me. She's like, hey, I have this pain in the hip, in the groin, in the leg, like I'm limping. I need a cane to walk around. Like, what are your, within 2 seconds, you probably need a hip replacement. Now, I don't love to push people that fast, right? We could look at some stuff, but you have a problem within the hip joint, I pretty much guarantee it. Now, of course, I haven't screened for, could it be tumor? Could it be this? I mean, I could ask more questions, but just based off that information, I hurt here, the hip or the groin, the knee, the front of the thigh. I'm limping, story, right? And when I do these motions, try to walk in her case, it bothers me. You could easily bring her through a couple other quick tests and say, it's a problem in your hip joint and you're going to need this, or I can't help you. 2 seconds. Doesn't need a month or 2 months to try to figure out what needs to happen there. I'm telling you, this process, DIY guide and DIY diagnostic network could save you a ton of time, energy, and money. And what's amazing about you being able to evaluate yourself, this is really what I care about as a teacher, right? Is that you learn so much during the process. You begin to learn what movements feel good versus bad, what positions your body prefers versus what it doesn't, what your pain points are, and so much more. You start the process of self-education and gathering feedback. And the more feedback you have, the better inferences you can make. And then through deductive reasoning, you figure out what you need to do or not. And this process kickstarts your understanding of what's going on, informs you of the natural treatment process moving forward. Now, here's the thing. I realize that even though I've mapped everything out here, and I talk about it very quickly because I'm excited about it, it's probably something that you're new to, right? Every single day, I hear people or am made well aware of the belief that, hey, Charlie, I'm not the doctor, though. You're the doctor, so you should be able to figure this out, right? No, well, like, I don't feel pain. So you're the best person to figure this out. So, Charlie, I'm not the doctor. How am I going to figure this out? It's not my job. It is your job. But that's very deeply ingrained. So we need to break that. And I'm just letting you know, this process of self-evaluation, which then naturally leads to treatment on the other side, is new to many people. And I understand, right? I get it, second nature to me, but working your way through this diagnostic sort of process, especially maybe on your own, might feel overwhelming. Probably does. No worries. Again, I get lots of people, even after going through the DIY guide, they're like, hey, let me share some more info. Then they write a book and they say, what do you think? What do you think? What's your opinion? I even have, again, clinicians and professionals who reach out to me. They're not even teaching this stuff in school. You can do this. So I want to help you get to the bottom of what could be going on. I want to help you get past that diagnostic phase as quickly as possible. And I want to help you do it for free for all the reasons I just talked about. And you can tell I'm really passionate about doing so. So the quicker we can get you beyond the figuring it out phase, get you out of that holding pattern, the faster you can move on to treatment. So here's what I want you to do. If you want to accelerate the recovery process and want to get my help and want my help getting clear on what could be going on and why you hurt, all the diagnostic stuff, because again, that should be very quick. Answer a few questions, go through boom, boom, boom. You should get a rough idea of boom, here's what's going on. Then I invite you to join my free private Facebook group, that DIY Diagnostic Network. Again, it looks like this. You will see the link above in a card and or in the comments or description below. And you can ask questions like this about diagnostics. Hey, my butt hurts here. What do you think? I could easily walk you through something and give you an idea of that. How can you tell if it's disc versus piriformis without an MRI? Here's what's going on. Is it possible to have sciatica and piriformis syndrome at the same time? Pretty simple answer. Pain is here, right? Just to the outside of the butt bone, the sits bone. And I get pain here. What do you think? I've got these results. Here's what it shows, right? What are your results? What do you think? Does anybody get this type of pain? What does it mean? Does centralization, right, apply to piriformis syndrome? If you don't know what that is, it's cool. But I'm feeling pain more here or here. Is this a good thing? Diagnostic, that tells us something perhaps. Anyone with piriformis syndrome ever experienced pain here or here? And stuff like that. And just a reminder, again, here's what you'll get inside the group. You'll have me, right, who will cover various topics around how you can determine the most likely source of symptoms and sort of what it means for treatment. You'll get exclusive video trainings to be able to watch actual live, recorded patient exams that will help you ID the source of symptoms. And you'll get access to myself on Messenger as I'm available to help you get clarity on what could be causing your pain, as well as answer any questions that pop up around that DIY guide. I chat with tons of people every single day. Thankfully, people are super cool. And most folks, if I'm bringing through some emotions, are like, hey, man, yeah, if this is recorded, like share this with other people. It'll help somebody cut to the chase faster. So again, when I talk about patient exams, that's what I will share. And essentially, this group helps expand or is a supplement to the DIY diagnostic guide. And you'll literally have access to the exact diagnostic framework I've developed for working alongside world-class orthopedic specialists. And I promise hold nothing back as it relates to this. The intent of the group, just to clarify again, is to help you bypass the old diagnostic model, if appropriate, teach you what you need to know and give you the support and clarity you need so you can move beyond the diagnosis as quickly as possible. I reiterate this because this is super important. Again, you've got this figuring it out phase that seems like you can never get out of. Time, energy, money's at. When really you need to move to treatment. So I want to shrink how much time, effort, and energy you spend there. And I want to get you to treatment. Now, look, as much as the network is created to help folks, it's not for everybody. So who is the network not for? Wounded healing the wounded. This is not a place to share treatment recommendations. There are lots of places you can do that. You can find a ton of them, all right? This is for diagnostic advice only. So what works for one person may not work for someone else, or what works for you might not work for someone else. Or it could make them significantly worse. And I see this every single day. People are like, oh, like I got this massage and it was great. Cool, but like your massage therapist might know something somebody else doesn't know. Your situation might be completely different. You might be 30 years younger. There's so many variables there. So don't recommend treatments inside of this network. Not cool. Random inputs or treatments equal random outputs or results. You're likely here, and if you're still watching, thank you, because you have some questions about what's going on. So you don't even have full clarity, let alone being told to do different things. And that makes it more chaotic. Random inputs equal random outputs, chaos, more confusion, and just burnout. This is what leads to people saying, like, I tried this and it didn't work because it was a random suggestion to begin with. And there are other places and groups for that. So this network is not for victims and warriors. So pain is fortunately a part of life. Its warning signals are designed to help us survive. It's a survival mechanism. If we couldn't experience pain, then we wouldn't be here. We all experience pain in some form or another throughout life. Does it suck sometimes? Absolutely. It may right now. Does pain make us go a bit insane? Absolutely. No question. But complaining about it or trying to fight it off won't serve you or others. I promise. Stay grounded. Negativity and finger pointing will not be tolerated. If you do decide to enter the group and I notice that, you will be removed. Fast fixes. Even though we do not share treatment recommendations inside the network, quick fixes don't last anyway. So if you're hoping for like some magical pill or overnight solution, right, it's not going to work. And it's not. And if it does, it's going to work very temporarily. All right. In fact, I would argue that it works against you and everybody else who's a part of this process because it spreads skewed expectations, false hope, and sort of sets the stage for failure. So recognize that I'm passionate about who this is not for as well, because I'm trying to protect the culture. I want you to be in a space, right, that is really focused and not just feeding you a bunch of crap, but really just like trying to move you beyond this. I don't want this to be one of the groups that you like hang out in for forever. Once you get what you need, let's do something about it. So this is a diagnostic group, final mention of this, hence why it's called the DIY Diagnostic Network and is not focused on specific treatment recommendations. There's enough of that stuff out there already. And by helping you figure out the most likely source of your symptoms, chances are you'll save a ton of time, energy, and money in the process. At least that's my hope. And now here's the catch. So Charlie, why are you doing this? What do you want from this? So look, after you've had your questions answered, you've got a good idea of like what's going on. You feel like you're at a stable point there, like, okay, I'm cool with this kind of ballpark idea. Great. The next natural step is treatment. So we want to move as quickly from that problem figuring it out phase to the solution phase, actually solving it, living in action. And there are 4 possible treatment solutions when you get to that point. You've got pills, shots, surgery, and motion. I'm guessing if you're watching this, you don't want pills, shots, or surgery. That doesn't mean that you might not need surgery. You might not need some shots or pills, but chances probably aren't very high. Instead, you've got natural treatment, motion of some form. You can either go to someone who moves you, chiropractor, PT, osteopath, massage therapist, you name it. This is you going to someone and relying upon that person to fix you. And you walk away and you're like, well, what did I get from that? I paid him my $30. I got an adjustment. Now, what do I know more so than when I walked in? Nothing. I used to do that, folks. I used to crack a lot of necks and backs and things like that. At the end of the day, it's disempowering. I'm not saying it doesn't work. I'm not saying there's no utility to it. I was very good at fixing people in the moment, but people sucked People meaning you in pain, the person in pain, sucked at fixing themselves. And so the purpose of this group is not to kind of like help you skirt by the whole internal process and work that you need to do. So if you're asking for like, hey, just tell me the exercise for that, then it's not going to work. But when you get to the point of treatment solutions, are you willing to put in the effort and the time, and yes, some money there, to learn how to move yourself, which is what I do. This is my bread and butter. I teach people all over the world how to fix themselves if they have unresolved back, butt, and or sciatica problems, any of these problems that you probably know me for, by teaching them a proven pain relief process. And people are doing the work. I am not fixing them, which creates long-lasting changes if you, the one in pain, are doing the work, because you're learning and you own that moving forward. All right, so look, that's the catch. If at that point, when you're like, hey, Charlie, thanks, you really helped me out with the diagnostics. If you'd like me to teach you that pain relief process, which I do inside of a private coaching program, we can have a chat to see if it's a fit to work together. If it's not, that's cool. And obviously, look, there's no pressure either way, but know that this is my specialty and I am here to help. Okay, so look, as a wrap up, if you're interested in joining the DIY diagnostic guide, then you can just click above. There's some card somewhere here and or below in the description and or comments. You can check that out as well. And I would love to help you kind of get clarity and just bypass that. That's really the passion here and sort of the driver behind it, is that so many people get stuck in that, and the thoughts and the beliefs and this whole model is just so outdated. And I want to give people sort of a new look. All right. So if you're interested in joining that, just click to join, answer a few questions. Please answer the questions. It's useful to give me some context. And then I will see you inside of the network or the group. All right. So that's it for now. Thanks everyone for sticking around. If you did, I appreciate it. And until next time, we will chat soon.